Okay, so in this video we're going to demonstrate how I examine a hand for carpal tunnel syndrome. I'll just kind of demonstrate some of the basic provocative maneuvers. With every hand exam, I just like to take a cursory look at the hand, see if there's any areas of swelling or deformity or abnormality, look at the skin, feel the skin, make sure everything looks and feels okay, and of course Melissa's hand does. And I do a quick neurological exam too to assess some of the functions of the muscles and make sure all the nerves that innervate the hand are working fine. So the first thing I have the patient do is just raise the hand up off the table just like this, spread your fingers apart, push out against me with your index finger. This is testing the first dorsal interosseous muscle here, which is innervated by the motor branch of the ulnar nerve. And then I have her flip her hand over, and then I will have her point her thumb up to the ceiling. Keep it up there strong, don't let me push down. This tests the thenar abductors, and this tests the innervation of the most of the thenar muscles, which are innervated by the motor branch of the median nerve. And then to just sort of demonstrate some of the provocative maneuvers, this maneuver here, you're putting pressure directly over the median nerve at the carpal tunnel. This is called the Durkins median nerve compression test. So I press here, and in somebody with an irritated nerve in the carpal tunnel, this will usually elicit numbness and tingling in the thumb, index, middle, and part of the ring finger. The median nerve, if you remember, innervates the thumb, index, middle, and the inside of the ring finger. The outside of the ring finger and the small finger is innervated by the ulnar nerve. So this is the Durkins median nerve compression test. Again, it should elicit numbness and tingling in the median nerve distribution. The Tinels test is performed by taking your finger, index finger, and kind of tapping along the course of this nerve. If that nerve is really irritated in and around the carpal tunnel, that will also cause little electrical shocks. The patient may report electrical shocks going to some of the fingers within that median nerve distribution. The Phalens test is when you ask the patient to keep the elbow straight and you flex the wrist like this. And usually flexing the wrist like this for 30 to 60 seconds will elicit numbness and tingling again in those affected fingers in the median nerve distribution. But it's important to keep their elbow extended. Sometimes I'll do sort of a combination of a Durkins test and a Phalens test by putting pressure right here. But that is, for the most part, a Phalens test. In addition to doing these provocative maneuvers, I also like to test the range of motion of her wrist. So go ahead and bend your wrist back, wrist down, and I'll measure the flexion and extension just to make sure they're within normal limits. And she's got, good range of motion. It's also a good idea too to probably take an x-ray of the wrist whenever you're evaluating somebody for carpal tunnel syndrome. There can be arthritic conditions or other things that can sometimes cause one to be a little more prone to developing carpal tunnel syndrome, and also check their ability to make a fist. The last thing I would like to demonstrate is how I test for sensation, specifically two-point discrimination. Two-point discrimination measures innervation density. Usually somebody can feel 2 points that are about 5 to 6 millimeters apart. That's normal innervation density. In somebody that can't feel that, it means that median nerve is not conducting enough electricity or signal from the brain to the fingers, and so that may be manifest then as an increased distance between these 2 points. So go ahead and close. So I usually have the patient close their eyes or look away. And I have them ask me if they can feel 2 points or just 1 point. Do you feel 2 or 1?
2.
2 or 1?
1.
And I go through each finger like that, and I measure, and I go to each side. So the radial side of the thumb, and the ulnar side of the thumb, and I do that for each finger, and I document what that 2-point discrimination is. And for many patients with long-standing carpal tunnel syndrome, their 2-point discrimination may be 10 millimeters, it may be 15 millimeters. And there's some patients that may have long-standing carpal tunnel syndrome that may have normal 2-point discrimination. And you can do the same thing with a little paper clip. You just kind of bend the paper clip in half and use the 2 little points and measure it that way. But that's the basics of an examination for carpal tunnel syndrome.